Hi, my name is Joe Josephson. I am an interventional physiatrist practicing here in southern New Jersey. My background is primarily in physical medicine rehab, and then completed a one-year fellowship at Temple University Hospital. My practice at this point is primarily interventional and mostly focused on neuromodulation as a treatment for chronic intractable pains. So I would say that the Bioness Stimrouter procedure has changed my practice in that it has really given me another tool to treat some of these harder to treat areas. So classically for neuropathic pain, whether it be in the shoulder or in the ilioinguinal region or in focal nerve distributions, your treatment options were somewhat limited. You had your nerve blocks, you had your chemical ablations. When those didn't help the patient and they were either on different medications and the patient continued to have refractory pain, the next step would be either a dorsal column stimulator or a peripheral nerve stimulator. The issue with the dorsal column stimulators was that you were covering areas of pain that the patient didn't have. So for a shoulder, for example, you were limited to treating the entire arm. And sometimes patient would get paresthesias in the hand that they didn't want and certainly did not need. So this brings us now to peripheral nerve stimulators, which classically were an electrode placed in a distribution of pain. And as you place the electrode, and then you would have to place a battery because there needs to be an energy source. So that battery required you to tunnel either to the anterior chest wall or to place a pocket in the lower gluteal area. And as you can imagine, tunneling becomes a real nightmare and can lead to other issues. So peripheral nerve stimulation kind of fell out of my practice almost completely. So when I was at NANS a few years ago, and I came across the booth for Bioness, and I was immediately taken by it. So when I went to the training last year and saw all of the different applications and realized that this is actually a really simple procedure and eliminates that entire need for tunneling by using an external generator site, it has really changed my practice. Now there are certain indications that have kind of fallen off for neuromodulation for me in my practice that now have a whole new treatment application for them. And I'd say at this point I've done about 10 to 15 cases, and the majority of my patients have been doing very well with it. So I'm very pleased with it. So by not having to tunnel and not having to create a pocket for the impulse generator, this has now really opened the door for a lot of docs who normally would not consider peripheral nerve stimulation as a treatment option to now have that ease and the accessibility to utilize this peripheral nerve stimulator and thus providing access to a really great procedure to a lot more patients. The procedure can be done either fluoroscopically guided, utilizing landmarks, or ultrasound guided. So I do the majority of my procedures ultrasound guided, as I've had the background in utilizing ultrasound to do the procedure. But if you can do an ultrasound guided block, you can do a Stimrouter procedure. So in terms of the Stimrouter itself, I've actually foregone chemical neurolysis as a procedure, as I have seen certain complications such as anesthesia dolorosa and other complications and actually just lack of efficacy, to be honest with you, for some of these ablation procedures. So at this point in my practice, I will do one or two blocks to confirm the diagnosis of a focal neuropathy. Once I have a successful diagnosis and a strong diagnosis in my mind, that I will offer the patient the Stimrouter procedure at that point. So it really kind of has come to be medication management, injection, and then Stimrouter. So what the way the patient is able to interact with the Stimrouter is they are given a controller, and they will sit with the representative from Bioness, and they will go through and actually create a treatment algorithm of different stimulation patterns. And the patient will be able to toggle through and get the type of stimulation that they want. They can either increase the intensity or decrease the intensity, or toggle through different programs that utilize different portions of the electrode to get the best pain coverage for that particular time in that particular pain situation. The goal here is to not put every patient's pain into the same box, but by having that ability to program the unit and allow for different types of generations of stimulation for different types of pain, the patient can now say, well, now it's at night. I don't want it to be as intense at night. And they'll be able to utilize a different program A, for example. And then in the evening or in the morning, they want it to be a little bit more intense because they want to get going. They'll have that control. They'll have that flexibility to be able to cover their pain the way they want it to, as opposed to the way I feel or the rep feels their pain should be covered.